Hello, and thank you for joining us as we discuss the COVID-19 vaccine, what it is, and how it works. I'm Laura Wheatholder. I'm a registered nurse and community outreach coordinator for Blessing Health System. I'm joined today by Blessing Hospital Chief of Medicine, Dr. Chris Solaro. Dr. Solaro, thank you for joining us. Would you like to take a minute to introduce yourself?
Yeah, sure. My name's Chris Solaro. I've been with Blessing for about 15 years now, and I'm a practicing emergency physician. And I also serve in an administrative role as chief of medicine and also director of our clinically integrated network.
Well, thank you so much for joining us today. And as I said, we're going to be talking about our COVID-19 vaccines that are available. So, our first question, there is more than one vaccine currently available in the United States. What's the difference between the two options?
Right. So there are two vaccines available, one from a company called Pfizer, which is a drug company, and another from Moderna, another pharmaceutical company. Both vaccines have received emergency. That means they've been studied and found to be effective and safe and have been released for immediate use by the FDA. They're very similar vaccines. In other words, they have the same mechanism of action, and they also have very similar efficacy. So they're very good vaccines. They work at about 95% efficacy. And the only big difference is the interval between the first and second doses. They're both two-dose vaccines. The Pfizer requires a 3-week interval between dose 1 and 2, while Moderna requires a 4-week interval between dose 1 and 2.
Okay, so two highly effective vaccines, both requiring two shots. For
Right,
Pfizer, it's 3 weeks, and for Moderna, it's 4 weeks between doses one and two.
right.
Okay, so now I understand the COVID-19 vaccines are different from maybe other vaccines that people might have received, like for the flu shot. Can you explain what makes the COVID-19 vaccines so unique?
Yeah, it is a different mechanism for a vaccine. So the basic idea between vaccines is that you introduce your immune system to a small amount of foreign material that your immune system can then learn to react against were it ever confronted with the real thing. And there's different ways to do that. So if you go back in history to look at vaccines, people used to give small doses of virus or bacteria to try to initiate an immune response. The vaccines that we're used to getting usually have little parts of a vaccine particle. Maybe it's protein or something like that. Some vaccines actually have a version of a virus that's not causing illness. It's called an attenuated virus. Um, the difference with the Moderna and Pfizer COVID vaccines is they're taking it one step back in production of what's called antigen or foreign material. So rather than getting protein injected with the vaccine, you actually get a substance called mRNA. mRNA will go into your circulation. It's taken up by cells, and cells use mRNA to make their own versions of foreign protein. In this case, it's called spike protein or a portion of spike protein, which then circulates and causes your immune system to get to know what spike protein looks like so that if it's ever confronted with a COVID virus, it's ready to go.
So the spike protein, if I understand, is kind of what we all see. We see the pictures of the COVID virus. The spike protein is the outside part, the spiky part on that virus that we all have seen pictures of or whatnot.
Yeah, that's right. And it's the spiky part exactly that we're all seeing. And that part protein is instrumental in attaching the virus to cells of your own body where it can then get incorporated into the cell. So that's the part of the protein that binds to what's called receptors that sit on the surface of a lot of our cells.
So the COVID-19 vaccines don't actually have any part of the virus. It's a technology that teaches our body how to make this protein, and then we react and have an immune response. Is that correct?
Yeah, so the first dose you get causes a reaction against a portion of the spike protein. So it's a little protein that looks like COVID, but is not COVID. It would be like if you had a car, you're just going to show the body the rear view mirror. It's not the whole car and it can't really do anything. What then your immune system does is learn what the spike protein looks like. The second dose amplifies that immune response. So you get kind of a small response over the first 3 to 4 weeks. The second is a booster where you get an identical dose of an identical amount of mRNA, and then your immune system really knows what it's doing so that if COVID ever were to enter your body, your immune system is educated and knows that it's a foreign material and can then attack the virus itself.
Great. So the COVID vaccines teach our body how to fight the actual virus without giving us the virus.
Yeah, yeah, well
Okay.
said.
So I guess one of the big questions that a lot of people maybe have are the vaccines safe?
They are safe. And, if you look at the CDC website, who kind of governs all of this, they state in their material that these vaccines have undergone some of the most intense scrutiny of any vaccine ever, even though it was very quick, which we can attribute to great technology and funding. The safety was established without skipping any steps. Most people do have a few side effects where they might get a sore arm or a low-grade fever or headache, but the serious reactions, like a serious allergic reaction, is very, very rare.
Great. Well, thank you so much. I think one of the other things that maybe we need to reiterate now that the vaccine is being administered, do we still need to worry about masks and social distancing and those kind of things that we've all become accustomed to?
Yeah, I wish I could say no, but it's true. While the vaccine is effective, number one, it takes time for your immune system to really get ready in case you are infected. So we wouldn't want you to feel like you're completely immune to getting the virus, even though you won't get sick from it. You could still transmit it. The other thing is we're learning in the news, we do hear about some new variations of COVID vaccine or viruses rather that are out there. And while the best data shows that our vaccines are effective against those, this is a little unpredictable, and I think it takes a little time. So even though vaccines can prevent illness and hospitalization, we still have to keep up with our social distancing and mask wearing to prevent transmission.
Is there anything else that you would like to add about the COVID-19 vaccines or about the virus itself?
I guess I would just encourage everyone listening to seriously consider getting the vaccines. These are safe, they're effective. This is the way we're going to defeat coronavirus. Vaccine plus masks plus social distancing, that combination will work. And we already see this year. If you look at influenza data, for example, most of us got a flu shot. We're all social distancing, and we have had like a very, very low flu season. So it works. And this is not new technology. This is a proven fact. So I would just encourage everyone to do all three of those things to try to defeat COVID.
Dr. Solaro, thank you so much for your time today. You can find more information about the COVID-19 vaccine on our website, blessinghealth.org. Thank you.
Thank you.